this is a great question, right? Health equity is another topic that I think has been just growing in terms of recognition of the impact of social drivers. And I think that for caregiving specifically, it starts with recognizing that there's a disproportionate impact of caregiving for underserved communities. So nearly half of caregivers are people of color and or part of members of the LGBTQ plus community. Members of marginalized communities face compounded challenges both in their health navigation and in caregiving. So, when I talk about the impact of caregivers on health equity, it's really in two ways. First, having a caregiver or a social support is a fundamental determinant of health. So what I mean by that is we need these folks, these caregivers, these family caregivers, to be supported. They need to be resilient and confident and empowered so that they can provide that fundamental social support for patients and members. And the second piece is that they are really navigators for both themselves and their loved ones in overcoming the other obstacles that we think about in terms of social drivers. So it's they partnering with caregivers becomes an added navigator for transportation issues, for financial issues, for food and nutrition. You can go through the recognized list of social drivers, and they're key navigators for that. So I think what health plans can do is to really think about solutions that, and I'll broaden that, not just health plans, but healthcare organizations more broadly, is to think about the needs of the caregiver, or to start from that caregiver point of view and address their stressors and concerns up front. And what I mean by that is caregivers often are faced with, we talked about this before, unfamiliar challenges that are right in front of their nose. And that is step one for them. That is the primary need that they need to solve. And by helping them with those broad set of tasks that we talked about earlier, not just the navigating care, but it may be figuring out advanced care plans, or it may be finding respite care, or it may be, you could come up with a list of lots of needs that might be right in front of a caregiver's task list. By serving those first, we can then earn the right and the trust and the relationship to influence their decisions in other ways. And so what I mean by all that is healthcare tends to, as an industry, we tend to want to figure out who we can assign tasks to. So if a patient is discharged from the hospital and is going home, but still is compromised and has needs that need to be met, we're pretty quick to say to a caregiver, here are the things that you need to do for your loved one when you get home, and ignore the stressors that caregiver may be facing on their own that might make them vulnerable or just low in terms of resilience to fulfill those needs. So we think about, from a Carallel perspective, providing ongoing engagement and a holistic set of resources for that full spectrum of needs, for the emotional support, for mental health, for health management, for financial planning, for navigating benefits, so that we can serve the caregiver's needs while then helping them on sort of a second set of needs that are more closely tied to health outcomes. And by doing that, what we've found, and was demonstrated in a study that we did through GuideWell and in partnership with the Caregiver Action Network, was that we could reduce stress in the moment of need for the caregiver, and that overwhelmingly that increased confidence in decision-making for the caregiver on a whole set of secondary and tertiary questions. And so that's the thing that I would say that primarily that healthcare organizations can do is to think from the point of view of the caregiver and from a relationship perspective, that we can support and empower them and therefore influence their decision-making long term.